So this is Andrew Blair, and how long have you been a patient here at Vista Health Center?
About 4 years.
Good, and what brought you here?
First, my back, the bottom of my back, my disc closed up on, and the nerves going down my legs. I had a really hard time working, walking, getting up, laying down. You know, all the pain was pretty bad.
Yeah, and then what was the encounter when you first met me, Dr. Stephanie Higashi, when we were going over what you were going to do with your back?
I was thinking about getting an operation and taking the disc out and having the bones welded together. And she called the place and asked them, you know, the prices. How much would it cost just to come in, you know, without this and that? And they said $250, and she said, "Come on, Andrew, I can get your back done for, you know, you're gonna have to come quite a few times a week, and then you know, and we gotta exercise it, and we gotta get that disc opened up and back into place, you know, the way it should be. And it's much, much cheaper, Andrew. It's not $150,000 to do this." And she was right. I mean, I was taking probably 20 Advils a day, easily. And I asked her, why do I still have pain taking that many? And she said, well, it's because your body isn't accepting the Advils, so it's just making the pain even worse. You've got to get off the Advils. And I looked at her and said, well, what am I going to take? And she said, no, you're not going to take anything. You're just going to do the exercises. And within 2 to 3 weeks, the pain was gone. You know, but even though it was a year of coming, and then the second year we decided to do it again, then the third year we decided to do it again, which is great, only, you know, once a week, once every 2 weeks sometimes. And then I was called and said, you know, you need to keep coming. And I thought to myself, no, 3 years is good. So I didn't come for 8 months, even though they called me every 3 weeks. Andrew, you should still come back in. And I said, no, I'm all right. And then one day it happened. I bent over to pick up a rag, because I do construction, and my back, I felt something go in my back. So I thought, no. So I got in the truck going to Home Depot, and I couldn't sit on the seat. So of course I thought I pulled muscles. You know, I just thought I pulled muscles. So I decided to stay home, not call, because I was scared to call Stephanie. You know? And then I found out I had to hold myself up to get out of the bed. And after a week, I called her, and she said, come right in. And it had slipped a little bit, because when when I first started, my back she showed me my back, so my muscles were used to that. So she told me that you're always going to have to exercise those muscles, because sometime those muscles might want to go back. Well, anyways, I'm back here again. I love the massages, and I'm telling you, the people here are great. And, you know, I'm not sure the machine they put me on, but I know working my back and opening up my discs all the time and, you know, doing all this stretching, it's really helped me, because I actually do construction almost every day of the week. And I'm very thankful.
Well, you're very welcome. And how many Advils are you taking now?
I don't take any Advils.
That's awesome. And how many surgeries did you have to have?
Oh, no surgery. It's good exercise. Good exercise, and I have to come back, but it's well worth it when you look at the work that I do. I do construction. I do maintenance and construction, but I carry a lot of 5-gallon stuff, and this next week I'll be carrying all the tiles. And I'm not worried about it, because I haven't had any problems in a long time. But, you know, it's the exercising, and, you know, you come once a week, they take care of you, and the massages are great.
Now, if there was a patient that was thinking about having surgery or was afraid to ever go to a chiropractor because they'd never gone before, and their doctors are saying you have to have surgery, what would you tell them?
I'd tell them to come see Stephanie. Because because they'd be saving a lot of money on top of that, and they would find out that there are exercises that you can do to open up those discs. And she also is a great doctor, I'm sure, in many parts of the body where, she would know to tell you whether you'd have to, if you had to get surgery, I'm sure she would tell you. But most all the people that she ever, works with, she shows them it's a lot of exercise, some therapy, and to believe in yourself again, and just try, just get it done.
That's awesome. We're very proud of you.